This presentation evaluates the efficacy of Federal House Bill 5052, known as the Safe Staffing for Nurse and Patient Safety Act of 2018. The bill requires that every hospital receiving Medicare reimbursement be required to develop a facility-wide staffing plan for their nurse workforce. Beginning in the mid-1990s, there has been a growing need to reform traditional staff ratios for nurses. There are many reasons for these discussions. It was initially recognized when the baby boomer generation began retiring. A study also linked national economic success with a drop in the nurse workforce. As the median income of American families was higher, more nurses worked less or not at all. There are concerns that healthcare changes and nurse shortages would impact patient care and safety dating back all the way to the 90s, but it was assumed that an understaffed unit negatively impacts patient care, increases the risk of error, and decreases nurse job satisfaction. All this seeming to be a realistic assumption, there was still little to no research at that time to back up those claims, making it a difficult one to support in times of financial strain on a hospital. In fact, these thoughts and these concerns for nurse shortages were what led California to pass AB 394 in 2002. They believed that minimal nurse ratios, while not resolving the entirety of the nurse shortage problem, would be a helpful starting point in establishing protective occupational standards for nurses. Studies did show that the minimal ratios improved employee satisfaction, but there was little to no improvement on patient outcomes, as had initially been anticipated. While some are inclined to see AB 394 as a failure, states like California have actually helped to pave the way by going great lengths to support the profession of nursing through these changes. They were quick to recognize a problem and to strive to address it given current research at that time. Through their efforts and the Affordable Care Act requiring hospitals to report core measures and key drivers, there are now far more resources available that have aided in the writing of Federal House Bill 5052. Little progress was made on nurse staffing reform until the passing of the Affordable Care Act in 2010. The nursing profession has spent the better part of 3 decades attempting to find a balance between patient acuity, staffing ratios, and fiscal responsibility of hospital units. In a lot of ways, the healthcare reform made financial situations worse, as previous Medicare reimbursement was not only cut, but much of it now resulted from measurable patient outcomes. To put it a different way, acute care facilities are being held to a much higher standard of patient care driven by evidence based practice, while receiving far less reimbursement than they had previously. This new set of circumstances threw the healthcare community into an unavoidable and previously unconsidered reality. Innovation is a must for facilities wanting to continue having a positive and healing impact on the communities they serve. In this frenzy of changes and policy, there's a temptation to make rash decisions, especially in the financial arena. A high cost workforce without measurable impact is at an increased risk for budget cuts. Nurses make up more than half of a hospital's labor budget. They're considered an expense for hospitals. They're not a source of revenue. So, this can make the nurse workforce an appealing area to reduce during times of financial strain. Safe staffing ratios has also historically been a challenge to fight for, as it has been difficult to measure the impact nurses have on patient outcomes. Until recently, nurses have had little to no trackable data that supports their impact on patient outcomes. House Bill 5052 is a response to this potential threat on the nursing occupation. It is an attempt to assist nurses in maintaining safe patient ratios while avoiding strong government oversight. While historically there has been limited research of nurse impact on patient outcomes, within the last couple years there has been a growing arsenal of data. Ironically, this can also be directly linked to the Affordable Care Act. While there were many challenges that resulted from this healthcare reform, one positive is that nurse related data has been a result of its goal to improve hospital practices. Patient safety and outcomes now directly impact hospital reimbursement. The federal government is involved in promoting patient safety and reduced length of stay. Research collected for reimbursement purposes is also being used to show a direct correlation between nurse perceived unsafe staffing ratios and poor patient outcomes leading to longer hospitalizations. obtained through Hospital Consumer Assessment of Healthcare Providers and Systems, also known as HCAPS. There are now multiple nurse related key drivers that can be used to track the direct trend between patient experience, outcomes, and the nursing care they receive while they're in the hospital. Also, patient satisfaction surveys have demonstrated missed care and its connection to nurse staffing challenges. House Bill 5052 is a bill that promotes government sanctioned social service while also allowing acute care facilities to retain safe staffing decisions. It is reasonable to assume that this new bill will be an attractive one for both political parties. Government interest on reducing patient length of stays and avoidable complications is a strong motivator for hospital administrations to spend more effort in improving nurse experience. It is a greater guarantee that putting money into staff workforce will actually increase government reimbursement for Medicare patients. House Bill 5052 might already be helping to impact better nurse outcomes. It shows that the federal government considers nurses to be a major influencer of patient outcomes. The bill's very existence actually helps to support the need for better shift regulations for nurses. It suggests that a practice gap has been recognized, which is increasing healthcare costs and poor outcomes for patients. The American Nurses Association is in strong support of this bill, affirming its ability to enable nurses and managers to collaborate more closely together on reducing poor patient outcomes and decreasing nurse error. Their initial studies of the 7 states that have adopted a Safe Staffing Act suggest that up to $3 billion could be saved from this act. By implementing a nurse staffing committee, not only should hospitals see a decrease in their serious safety events, but they also should see a reduction in avoidable hospital readmissions, ones that are not reimbursable by Medicare. The ANA also suggests that House Bill 5052 will help protect nursing as an occupation by keeping crucial everyday decisions in the hands of bedside nurses and their nurse leaders. They view it as optimal in supporting and promoting professional education, certification, and proper job training. The ANA views this bill as having taken into consideration evidence based research that patients are consistently in need of reevaluation in regards to their acuity, their stability, and their nursing need. It recognizes that set staffing ratios do not take that kind of patient change into account. House Bill 5052 establishes a clear expectation that the people best suited to make nursing staff decisions in the best interest of the patient and the nurse are the licensed professionals who are providing that care. This bill comes at the Safe Staffing Initiative from a few different angles. First, it requires that each hospital have a facility wide staffing plan for the nurse workforce. Part of what's required for this committee is that at least 55% of the members be nurses who provide direct patient care from every unit that would be impacted by the staffing initiative. The committee must include hospital nurse managers and would have the freedom to include any other hospital personnel that the facility may deem appropriate. But the key is that bedside nurses would hold the majority on this council. The purpose of hospital staffing committees would be to develop a staffing plan for the nurses. They would be required to meet regularly to evaluate the impact and the implementation of their plan. They would also be tasked with developing safe plans for overtime management, mandated breaks, and relief during times of staff absences. It's a robust bill, taking into consideration multiple different impacts to nurse and patient safety, and requiring the committee to develop contingency plans for sick calls, meal breaks, specialized units, and a declared state of emergency, just to name a few of the categories. Also, it would require for the committee to make their staffing initiative available to the public if requested. It would be electronically uploaded to the Hospital Compare Internet website, which is overseen by the Department of Health and Human Services. Each hospital would also have the potential to be audited at any time to verify their compliance. One thing that AB 394 showed in its impact positively for California nurses was that employees were more satisfied in their job and there was an increase in nurse retention at the facilities they were working. There are many anticipated benefits of House Bill 5052. According to the 2018 National Healthcare Retention and RN Staffing Report, 2017 saw the highest level of nurse turnover within the last 5 years. It's estimated that anywhere from $30,000 to $60,000 is spent on new employee orientation. Staff retention and growing financial challenges can be what makes or breaks an organization. This would be one seen benefit to passing this bill. In a recent study, patient acuity was also found to have the strongest association with three measurable adverse patient outcomes: medication errors, patient falls, and UTIs. Consistent and mandated nurse staffing ratios showed only a weak association with these measurable adverse patient outcomes. This study provides a clear demonstration of the many factors impacting a nurse's stress in the workplace and patient outcomes. It also measured trends between employee engagement in their workplace and increased percentages of staff satisfaction. Both results indicate that this is not a scenario that can be fixed by standardizing staffing across an entire state or country through mandated ratios. It further supports the route that House Bill 5052 takes in helping to establish assistance to nurses in promoting their implementation of a safe staffing plan while also impacting enhanced nurse engagement in workplace decisions. House Bill 5052 is well written and worthy of consideration, but there are some alterations that would enhance its impact for nurses and patients. First, it would be helpful to write into the bill a requirement that hospital committees publicly submit evidence-based research to support staffing models they develop for their facility. Along with this, facilities would need to provide evidence of internal studies and surveys conducted of their staff, which would help to diagnose staffing challenges unique to their facility. This could feel a bit invasive, but I believe it would serve a dual purpose. It would hold staffing committees accountable to make reasonable decisions in designing their staffing expectations. It would also end up being a helpful resource available to other healthcare facilities, which would aid in collaboration and further improvements. Second, given the strong correlation between patient acuity, nurse staffing, and patient outcomes as discussed in the previous slide, it would be wise to add that each hospital be required to have an active acuity scoring program, updated at least once a shift by a nurse manager or bedside nurses. Research indicates that staffing surveys, while a useful tool in determining staff satisfaction and engagement, is not wholly reliable without a patient-centered data collection to aid in comparison and to track trends. An acuity program would help acute care facilities monitor the effectiveness of their staffing plan and assist the committee in future decisions or alterations. Nurses have endured a long road of working through how to transition traditional staffing models in a consistently and constantly changing healthcare arena. They are the largest healthcare workforce and the most trusted. They are the ever consistent, compassionate patient care advocate, providing selfless and intentional care to patients. They're the backbone of healthcare, and yet it's clear that they need to be supported through the turbulence of healthcare reform. House Bill 5052 is a timely response attempting to take a multifocal approach in responding to these challenges. It's an attempt to assist nurses in maintaining safe patient ratios while avoiding strong government oversight. Through this bill, there is an opportunity to help better regulate and support acute care facilities in providing safe nurse staffing scenarios, while leaving the ultimate choices for design and implementation in the hands of nursing professionals and hospital administrators. A nurse's role is ever changing, but the goal should always remain the same: to provide safe, effective, and compassionate care to any and every patient, regardless of the circumstance. House Bill 5052 will strengthen the nursing profession as we continue to strive to give our patients the best care possible.